And it seems that there are also young women out there who are going under the knife for a little extra lift. According to latest figures, the number of younger women aged between 30 and 45 who are getting this procedure done has grown steadily by up to 10% every year.
But what are the pitfalls of going under the knife earlier? Well, to help us with the answers, we have with us Dr. Randquist, a world-renowned plastic surgeon, and Dr. Tan Ying Chen, a visiting consultant to KKH's Department of Plastic, Reconstructive and Aesthetic Surgery. Good morning, gentlemen.
Good morning, gentlemen. Good morning. Dr. Tan, maybe we'll start off with you. How common is breast augmentation here in Singapore?
Well, unlike the United States where figures are collected, Singapore we don't have the exact figures. However, it's estimated that about 400 procedures happen every year, and this number is slowly increasing by about 5 to 10% every year.
Right.
I've noticed that, say 10 years ago, breast enhancement was purely aesthetic, and they kind of looked a little bit fake probably 10 years ago, but now it's looking a little bit more natural. Is this a trend that is really happening?
Oh, definitely. I think with the devices that have been developed the last 15 years, we're able to customize and really individualize for each and every woman the kind of shape which gives her a natural proportional look. I think that's a trend worldwide, going from that fake look, and by having that possibility, we're able to create quality of life for these women who seek a figure which will give them something of having a good relationship with their partners, dressing themselves, but it doesn't look fake in any way.
Is it a matter of self-esteem in terms of quality of life? What do you mean by quality of life?
Definitely. I mean, a lot of women who breastfeed, they get breasts where they don't feel comfortable. And obviously having that small implant in there, giving them that quality of life, will give them more self-esteem.
What about in Asia, Dr. Tan? Do you think, for example, in Singapore where you meet women, is there, I guess, in an Asian culture, it's something that we're not as readily accepting in a way to some extent. Do you think that is changing? That more women are, because even if you did it, you often deny ever having done it.
Exactly. I think things are changing. I think there are a few reasons why it's changing. One is internet, the media, a lot of like programs like Tub and Extreme Makeover. So people are beginning to understand more about plastic surgery, becoming more receptive to plastic surgery, and then they are beginning to get more information from the internet. So they are more educated now, and they are beginning to accept this, and then they understand now that all these procedures are able to help them to look better, and then they will ultimately also get potentially more natural results, as Dr. Randquist has just mentioned.
Well, we got to mention, of course, there have always been horror stories you hear of things gone wrong, and just recently, Amy Winehouse, the singer, was admitted to hospital. She had some pains after getting breast enhancements. I mean, what would you say to that? Has technology improved to the point where we can be not concerned about these things, or how?
One should be concerned. Surgery is never without risk, and I truly mean one has to be very accurate about that. However, having said that, the way surgery is conducted today in a safe environment by board-certified plastic surgeons, yes, you're more bound to have good, safe results, not just short-term, but also long-term. And those are the differences today. I mean, reports like one you just mentioned about Amy Winehouse, I don't know if that's accurate or not accurate, but media has a tendency to show those things. But the truth is that most women that walk around with breast implants, it doesn't show if it's done in a natural way. But yes, one should be concerned, and as a doctor, one is obliged to really inform the patients about those risks. However, latest data, done in a good way, show that those ones are quite small.
Dr. Randquist, you're here to conduct a live breast surgery workshop to tell people about the latest techniques. What are some of the new techniques that are used?
Well, the thing is that we have devices today where we can individualize and customize, basically meaning that a lot of the implants that we're implanting today are asymmetric, anatomical, and thereby we're able to shape the breast, not just voluminize them. And that's what it's all about, shaping. And we've been doing this now for a couple of years all over Asia, but since 2 years we've been able, in cooperation with KKH, develop this clinical excellency where we're educating doctors from all over Asia. So I've been doing this now. We've done 15 of these educations in Asia, and we've had 3 here in Singapore. And so we have all these distinguished, well-educated doctors coming from all over. And this time we have from Australia, New Zealand, Korea coming here. So The latest technique, it's just showing that performing non-traumatic surgery based on proportionate thinking and good planning will ensure quality of the surgery.
But what about in the past? There was only silicone as the option, I mean, and I guess you chose either A, B, C, or D. I mean, well, I guess you wouldn't choose A.
That's not the way to do it.
No?
No.
So how's it changed now? What is available for women out there? When you say it's just about shaping the breasts, I mean, what do you actually mean?
Well, the thing is, today we're able to have more cohesive implants. They're silicone implants, yes, but this cohesiveness gives us the possibility to have shaped implants, and thereby we can put volume where it's needed. So, for instance, if you have a woman who has breastfed and there's a lack of volume in the upper pole, you can give some extra volume there without having that roundish look. Now we have to understand this is a matter of taste. Some like round ones, some like more natural. I don't have any problems using round or anatomical. It's a matter of taste. That's philosophy. But I want it to be safe. And I want women and doctors to understand there is a procedure out there that is safe.
And speaking of safety, Dr. Tan, perhaps you can tell us what are some of the questions that women should ask if they're considering surgery of themselves and also of their potential doctor?
Well, what they should ask is whether or not it affects breastfeeding later for those who have not had children. So the question is, it doesn't. Next thing is the relationship to breast cancer. So there are many studies who show that there is no real relationship with breast cancer. So they will have to understand what exactly the procedure involves. For example, what implant is going in, what kind of incision it is, and where the implant will be placed, whether it's above the muscle or beneath the muscle, and what are the restrictions to activities after the surgery, what do they expect during the recovery process. And these are the questions they need to ask during consultation with a plastic surgeon.
Okay, so as you mentioned, it doesn't affect breastfeeding at all. Women should still be able to continue to breastfeed their children as it was normal prior to that.
Yes, in this part of the world, many of the implants are placed beneath the muscle because generally women are rather skinny. So this is away from the breast tissue, so it shouldn't be interfering with.
Just very quickly, we've run out of time, but I want to ask you, is there an age when it's too young for a woman to? What is the age that they should? Is there a cutoff age when? I mean, because they're still going through puberty, they should wait for things to fully develop.
I mean, you mentioned it yourself. I mean, puberty. If one is in puberty, depending on going there in age 12 or 14, of course one has to look at that. But one has to understand it's the indication as such, not the age. I've met women that are very mature, being 25, and women that are 19 that are quite mature in the relationship with their body. So it's a maturity thing and an indication thing. And I just want to emphasize something. The risks and correlations, patients talk about cancer. We've studied these implants for a very, very long time. It is a very safe product, and I think that needs to be emphasized too.
Okay.
All right, thank you for coming in and sharing with us your insights this morning. That was
Dr. Randquist and Dr. Lim, who've been talking about
Dr. Tan, rather.
Dr. Tan, sorry. Talking about the risks, latest trends and safety issues in breast enhancement.
Well, of course, awareness is key. Ask questions. Go and find out more information before you do anything like that. Surgery is still surgery. Well, for a quick break, back in just 2 minutes. Keep here on the channel.